Hello, everyone. Welcome to our third part in our Body and Soul Wellness for Students webinar series. We're so excited to host our third night of this. Welcome back to anyone who has joined us for our previous two sessions, and welcome to anyone who's joining us for the first time. Like always, tonight's session is being recorded and will be posted later on, so if you need to reference this session or any of our previous sessions at a later time or would like to pass it on, that will be available to everyone afterwards. Tonight we are talking about pain management. I'm super excited about this one because it's something that I hold near and dear to my heart. So I'm really interested in everything that we're going to be talking about tonight. So tonight we're going to be hearing from a faculty member within our occupational therapy department. Dr. Rita Burlingame-Topin is an integrative occupational therapist who specializes in holistic pain management strategies and is also an assistant professor within our occupational therapy department. So tonight we're going to be discussing just what it means that when our body is in pain, what is our body trying to tell us, and then different ways that we can address that pain as well, particularly right now when places like yoga studios or going and getting a massage, those places might be closed right now. So how can we do that at home and kind of manage those pain symptoms at home? So I will turn it on over to Dr. Rita to walk us through that.
Thank you so much, Bree, for the wonderful introduction. It always makes me feel fancy when someone calls me doctor. A lot of us go by first names here. So I'm really excited to talk to all of you about pain, which is one of my favorite subjects, and you'll find out why in a little while. I've been going to give you a small piece of one of my favorite lectures to give. And the reason that I really enjoy teaching people about pain is because when we understand what pain is and what pain means, we have much more power over our ability to respond to it, and we can look at it as a messenger that is helping us. It's helping us to prevent further injury to our body, and it's telling us that we need to change something in what we're doing. So pain doesn't have to be this frightening thing that we want to avoid. Pain can be something that we notice and then we learn from. But before I go into the specifics of pain, I'll just introduce a little bit about what occupational therapists do. We are a profession that has such a wide scope. What we do is we help people do the things that they want to do better. We help people to perform the daily activities. An occupation is a daily activity, something that we need to do. It's not just an occupation like a job. It's whatever we need to do during the day. So what we do is we help people to move better if they can, or we can adapt the processes by which people do things, or we can change the environment. So one of the things that I specialize in is helping people who have pain to navigate the signals that their body is sending them better, and also to change the environment if we need to. So in a little while, I'll talk a bit about how you can set up your space. I'm really honored to be a part of the Mount Mary University Occupational Therapy Program. Our program is over 75 years old, although we do update our curriculum every year. So, and we are a really wellness-focused university, which is something that is near and dear to my heart. Engaging in things like yoga, meditation, a form of massage called myofascial release. Those things have changed my life immensely, and it's really important for me to teach about how healing these modalities, these holistic modalities, can be. So before we get into the content, one last thing that I just want to say is that I'll be talking about muscle pain tonight, and I'll be talking about general aches and pains that we get from sitting too long, driving too long, or maybe just over-efforting. This is just general information and not meant to substitute medical advice. Always, if you have any sort of pain that is new or different, you would want to contact a physician or an occupational or physical therapist to help you out. So without further ado, I'll pull up my PowerPoint here and we'll get started. All right, so pain, your body produces pain when it believes that you are in danger. That is the signal that your body is trying to send to your brain. If the brain thinks that you're in danger, it's going to create pain. The brain is alerting you to a signal that it believes is crucial to your survival. And if your brain didn't think that the pain was important, you wouldn't feel that pain. So the example that I like to give is if you think about when you are walking through your bedroom at night and the lights are off and you hit your shin or you stub your toe, you're going to feel that. That is going to feel like a lot of pain. It's going to be shocking to you because your body is telling you, hey, stop doing that. That's a dangerous thing for me to do right now. Now, if you were in the woods and you were running from a bear, hopefully we're not experiencing that anytime soon, but if you were running from a bear and you stubbed your toe and you hit your shin, you wouldn't feel that pain because your brain is going to sense that this bear is the danger. And so that's the danger that I need to pay attention to and I need to get away from it. So understand that pain is simply a signal. The receptors that send pain to your brain are called nociceptors, which means essentially danger receptors. So think about when I hear pain, it's my body telling me something that's happening might be dangerous. Now the good thing about pain is that pain is a really strong signal. It's not something that most people can ignore for very long. Pain makes you move differently and pain makes you behave differently, which makes pain vital for healing. It's our body sending us a message that we need to change. Now, not every single person is going to have the same pain experience. This is called the biopsychosocial model of pain, which calls into our mood, our attention, our prior pain experiences, our culture, and what we have learned about pain. Those can all affect our perception of pain. So pain serves that biological purpose of getting our attention, and pain is both a sensation and a perception. So our sensation is what we feel, and then our perception is how we interpret that feeling. So I like to share a personal experience with this one is probably about 8 years or so ago now, I had a pretty bad back injury. I herniated a disc and I was in a lot of pain. I was having some nerve symptoms and it was pretty scary for me. Fear can actually enhance our perception of pain as well. And when I was going through that, I was experiencing a lot of pain, partially because I was very afraid that I was going to have permanent tissue damage. Now, as I started healing, my body, the tissues started regenerating. I had pulled some muscles as well. Those muscle tissues started rebuilding, and I could slowly do more without experiencing a high level of pain. But that pain, as I was healing, it was my body telling me, whenever I stretched, that it was too much. That was my body saying, you can't go that far anymore right now while you're healing. So it was serving a purpose. However, also, for a few years after that, anytime I would exercise a little too hard and feel a little tweak in my back, I would become very fearful and my pain would increase. Now that I have healed, I've done a lot of physical and occupational therapy and self-work to heal from that injury. If I get a little tweak in my back, if I'm in the garden or pick something up too heavy, I don't go to that fearful place. I say, okay, this is my body telling me that I just need to back off, that I can't work that hard, I need to stop sooner. So the way that we interpret those messages can actually decrease our pain if we can decrease our perception, so the way we interpret that feeling. Other examples might be if someone's really athletic and they have that no pain, no gain, they're going to have a different perception of pain. They may have a much higher tolerance for pain than someone who doesn't have that idea of no pain, no gain. You can also think about how, sociocultural experiences can impact pain. Somebody who is a single parent and is injured on the job, they might be more fearful of losing their job or potentially taking time off work than they are of that injury. So it's going to shift the way that a person responds to pain. Now, what I'm going to be focusing on in this lecture is, like I mentioned before, this idea of myofascial pain. So when you hear the word myofascial, myo means muscle, and fascia means essentially that connective tissue that is wrapped up and surrounding the muscles. So just kind of the muscle unit, essentially. And so this myofascial pain, it's often called trigger point pain. So sometimes a lot of us, especially if we're doing a lot of work on the computer, we're going to have a little nodule or muscle tension right in our trapezius muscle, right here, kind of between the neck and the shoulder. And so when you put pressure on that point, you might feel pain in that point, or because the fascia wraps and connects all the different muscle groups, you might feel that pressure distally. So you might feel, if you put some pressure there, you might feel it in the front of your shoulder because that fascia that wraps and surrounds the muscles, that can be pulled from that farther away, or what we say distal point. And now these myofascial trigger points, these are really common, these are really normal. If you run your hand kind of down the side of your leg, you're probably going to feel some tighter muscles along the side there. That's really normal. It can happen from an acute strain, which would be just, overdoing it in the gym, picking up something too heavy. When you move, this happens a lot. You're picking up and moving a lot of boxes. Even I was talking to this with the other webinar hosts, when we take off a heavy purse and set it on the car seat next to us, that's a time when we commonly strain our shoulders. This can also happen when we have a sustained muscle contraction. So if we are driving for a long time, we've got our shoulders up, that can start to cause some of these trigger points, or a traumatic injury. So a car accident or something like that can also cause these trigger points to occur. Sometimes when our muscle stretches too far, what our body says is, I don't ever want to stretch that far again. I'm going to tense up so that it's not possible for me to stretch that far. So that's another reason why you might get some tension. Excessive sitting can cause it. There's a muscle called our psoas, which is such an interesting muscle, to me at least. I don't know if you all have a favorite muscle, but maybe if you join the OT program, you might end up with a favorite muscle or many favorite muscles. But the psoas muscle, see if I can shift and you can see me a bit. So your psoas muscle connects your low back. It runs diagonally through your body, and then it connects at the front of your leg. So one of the things that the psoas muscle does is it brings your knee towards your chest. And this position that I'm in, if you can see me, it's a position where a lot of us spend a lot of our time with our hip bent and our knee bent, the sitting position. Now this muscle, the psoas muscle, is also an important muscle for running. And so it can be a muscle that can tense up during the experience of fight or flight, when we get anxious or when we get nervous. So kind of the perfect storm for some psoas muscle pain is we're sitting in a desk and we're nervous because our body doesn't always know the difference between the nervousness that we feel taking a test and the nervousness that we might feel if a bear were chasing us. So at the end of this PowerPoint, I'll show you a stretch that you can do that can help you for those times when you are sitting in a desk for a long time and studying and you might just be feeling a little bit nervous. Forward head, that's another common way that we get these myofascial triggers. So if we're texting on our phone, I know I do this way too much these days, and I think a lot of us do, bringing our head forward isn't good for us. And then any sort of imbalance, if we're always picking something up from one side, if we're always turning one way when we do an activity, if we're always having a purse on one shoulder, if we're sitting the same way, crossing our legs, all of these things over time can result in muscle imbalance, which doesn't necessarily mean anything terrible for our bodies. It just means that we need to shift so that we can restore more balance to our bodies, or we need to do something like stretching or yoga or some exercise to bring ourselves back into balance. Now this is going to be on a test at the end of this webinar, so just make sure you take notes. I'm just kidding. This will not be on a test, and this is just a sample of what you might see in one of my favorite lectures, the pain lecture. But what I want you to get from this slide is not to try to memorize everything on here, of course not, but to understand that what is happening is there's a cycle that's recreating itself, and it's kind of a feedback loop that gets worse if we don't know how to interrupt it. But the good thing is, if we learn how to interrupt it, we can interrupt this pain cycle, and then we have control over our pain. So we've got a triggering event, so something happens. Some of the things on the previous slide, something happens. And then we get these chemical signals that tell our muscles to go into spasm or to tense up. So just think, something happens, a chemical signal tells our muscle to tense up. Then what happens when that muscle is tense, it's going to have decreased circulation, which is going to make it so there's less oxygen getting to the muscle because that circulatory system, the blood isn't flowing as well as it could be. And then our body is going to sense that. It's going to start to have some pain, and then the body is going to interpret that as stress. But then what happens when we have stress is that we send more signals to our body to get more tense, which causes more pain and less circulation. So what we need to do is interrupt that cycle. Anybody have an idea of a way that we might be able to interrupt that cycle? We're going to talk about it. I'll let you just think about it for a moment. Think about ways where how we might increase our circulation, we might decrease our stress, or we might increase our oxygen. So those are some of the ways that we can think about how we might break this pain cycle. So there's another theory of pain and how pain works. That last slide was kind of the muscular explanation of what pain does, and this slide is a bit more of a neurological explanation of pain. So there's gait control theory, and gait control theory, there's sensory nerves that go from our spinal cord to our brain, and there's essentially this gating mechanism. We call it, it's a gate. And when we can bring a non-pain stimulus to the body, that can interrupt and close that gate. So I think about non-pain. An example of non-pain might be heat or cold or pressure. So what happens if you, let's say you bump your knee, you're walking and you bump your knee, what's the first thing that most of us do? Is we start to rub our knee, because pressure, that sensation of rubbing our knee, will decrease the sensation of pain. So things like heat, things like cold, things like pressure, that gets to our brain first. It's faster than pain, and so it can close that gate so that pain can't get in. So that's one of the reasons that things like massage work, and it's one of the reasons, it's not the only reason, that things like heat and cold work. Now the next thing, the next part of this is what are you able to do with this information? So knowing these things about pain, how can we treat ourselves? So the first thing that I always teach my clients, that I use whenever I am experiencing pain, is this attitude shift. Allowing ourselves to feel more empowered by acknowledging that this pain is a signal. This pain is a survival mechanism that my body has learned that is beneficial to me, because what it's telling me is that I need to change something. I need to do something different. So I encourage anyone, when they are feeling that little twinge of pain start to come, to instead of getting scared immediately or instead of getting worried immediately, to say, thank you, pain, thank you for protecting me. What is it that I need to do? And it's not to say that pain is in someone's head or anything like that, or to say pain isn't scary, because pain can be scary. Sometimes pain is intense, and what it is telling you is that you need to go to the doctor. But sometimes what pain is telling you is that you need to stand up and stretch and just move in some different ways. So you do have the opportunity to thank it, even though sometimes it will be easier than other times, certainly. So just going to share a couple of concepts. So one of the things that we can do to treat our pain is to blink. So you think about when we are staring at our computers, which a lot of us are a lot of the day now, we blink, and that's going to help prevent our eyes from getting strained, from being in the same position, from looking at something close. Well, we can do the same thing with our muscles. We can blink our muscles and have a quick stretch session. So every maybe half an hour that you're sitting at the computer, you can set a timer that just says blink, or you can remember maybe when you're blinking your eyes, like, oh, I should do this with my muscles. So if I'm doing a lot of this position and typing, oh, I need to blink and stretch my wrists back. I'm doing a lot of forward head, looking at my cell phone, oh, I need to blink. Let me bring my shoulders back and look up. Just those quick movements can help to keep things moving, keep the circulation moving in the body, and prevent muscles from getting overly tense. Also, opposites is a great way to think of this as well. So again, using the example of I'm sitting at a computer with my arms forward a lot of the time. Now I think, what's the opposite of that? I can stand and reach my arms back. If you are doing a lot of activities where you're bending forward, maybe you're picking up a child, well, then you can do the opposite and stretch backwards. So think about, what am I doing a lot of, and then what's the opposite of that? And I want to try to perform that opposite movement more often, that's going to help my muscles to stay in balance. Ergonomics is important too. A lot of us have probably shifted how we're doing things, spending more time at home, possibly spending more time sitting down. So you can set up the space optimally. You want to have your screen at the level of your eyes. You want to have both feet on the floor, and then your elbows and your knees both at 90. That's the ideal setup. You can do a Google search for Mayo Clinic and ergonomics if you want more information about that, and that will give you some templates of how you could set up a space more ideally for you. I also recommend having a lot of different options in your space. So I have a bookshelf next to me, and I've cleared off a few shelves so that I can stand and work at a computer, or I can sit on the floor and work at a computer. Also, those exercise balls for chairs are really fantastic. I recommend those to people who have back pain a lot, because you're going to keep moving your body while you're sitting on those chairs, and then your muscles are going to be tensing and relaxing and tensing and relaxing. It's going to challenge your core musculature a bit more so that your back isn't doing all the work. So those ball chairs are nice options. But honestly, one of the best things that you can do for your body is to move in a lot of different ways. If you have mobility, use your mobility. So sit, stand, lunge, squat, lay down. Think of all the different ways that you could work on your homework in different positions rather than just sitting. And again, going back to this idea of stopping the cycle, we talked about how decreased oxygen, decreased circulation, and increased stress and muscle tension, those things all contribute to pain. Yoga is an excellent activity because we can increase oxygen because we're increasing our breathing. We're doing long, deep breaths. That can also decrease our stress. And then we are both tensing and relaxing our muscles in that practice. There's a website called Glow, GLO.com, and they have a free practice that I think that they update every month or so. They started doing it during COVID-19 so that people who were unable to pay for their services or unable to go to a studio had access to a free practice. So I recommend Glow as a really great yoga and meditation website that's free. Closing the gate. Again, we talked about how pain stimulus, so the sensation of something like heat or cold or pressure can help to reduce that pain because it either closes the gate completely or partially closes the gate. So heat can increase our circulation as well and relax our muscles. Cold can decrease inflammation, which is another driver of pain. What's important to know about cold is that it can increase our muscle tension slightly. So you wouldn't want to use cold and then do an activity immediately afterwards. And of course, heat, if someone doesn't have great sensation, if they can't feel how hot something is, there is a risk for overheating or burning the skin. So these are things that you would want to be very cautious with. And if you have any type of condition, talk to someone like a physical or occupational therapist who could help you determine a plan for you. All right, so the last couple things are things that I will demo to help show you some things that you can do at home. So we'll talk about pressure and self-massage, and I'll show you how you can make your own self-massage tools. So I'm going to go through the things that are on this slide in a moment. These are my references. Now, before I shift to demonstrating, does anybody have any questions that you'd like me to answer before I make a shift. All right, take my notes here so I remember what I'm doing. So I've got my yoga studio set up here for you. So one of the things that I talked about is how you can put pressure on a muscle to increase or to decrease the muscle tension. So one of the muscles that gets tense for us a lot is our pectoral muscle. So when we're doing a lot of driving, a lot of sitting at the computer, our arms are in front of our chest a lot. And so these muscles can become tense. So we can do a prolonged, gentle pressure, and that can help to decrease some of the muscle tension that's rounding our shoulder a bit forward, or it can even be pulling on our neck a little bit. So what I do is I recommend that people put their arm across their body, and you can do it right now if you'd like. You'll feel a muscle that's going to kind of pop up. You'll feel it engaging. And then that's the muscle where you want to put some prolonged, gentle pressure. Just putting the palm of your hand there. And it takes about 2 to 5 minutes for a myofascial trigger point to release. And so once you're holding your hand there, you might feel that it feels good to kind of gently tilt your head, to move your arm. And you're doing a pressure plus a little bit of stretch and movement, and that can help to decrease some of that muscle tension that you're feeling. Another way that you can do self-massage, I had on that slide either transverse massage or longitudinal massage. So transverse means against the grain of your muscles, and longitudinal means along the grain of your muscles. So another muscle that's commonly tense for those of us that are sitting on the computer a lot is our trapezius muscle, our upper trapezius muscle. One of the actions that that muscle does is it brings our shoulder towards our ear. So if you want to feel where that muscle is, you can feel, just go back a bit, kind of on the back of that space between your shoulder and your neck. And then just bring your shoulder towards your ear, and you're going to feel that muscle engage. A lot of us, I always feel like I have a little rock in there because I tend to hold tension there. So I can take my hand and rub across that muscle, or I can rub along that muscle. And either of those things can provide that pressure. It can increase the circulation, and it gives the muscle a cue that it's allowed to relax. Of course, you want to be careful. You've got lots of veins running through your neck here, so you don't want to be directly on your neck. You want to be on this big muscle that is on the back of your shoulder there. Another tool that I love to teach people how to make is your own self-massage tool. If you have 2 tennis balls, you can do this. In a pinch, I've had people do this with potatoes. You obviously have to change your potatoes regularly. Potatoes are not ideal, but you can use 2 tennis balls and a long sock, and you can make your own self-massage tool. So all you do is you put your 2 tennis balls into the sock, and you push all the way down to the bottom of the sock. I chose a fun blue and orange cheetah sock, but you can get as creative or as simple with your sock as you would like. So you've got your 2 tennis balls in the end of your sock, and then you're just going to tie a knot so that they stay where they are. And then this is a great tool. You can put it along the side of your leg and just kind of rock, put some pressure. Your IT band is a muscle that connects the side of your hip to the side of your knee, and it can become very tense in a lot of people. So you can just rock, you can hold the pressure there. Piriformis muscle is a muscle on the side of the glute. That's one that gets kind of cranky on a lot of people too. So sometimes I'll kind of shift and sit my side of my hip. And just rock from side to side. There's a lot of things that you can do. You can put it underneath the calf. And you just want to make a note to be careful. Like I've said many times during this, if you have experienced pain that you're not sure what it is, you want to see a doctor or a physical or an occupational therapist just to make sure that it's nothing concerning. But these are things, you know, for somebody who would be at a high risk of moving a blood clot, we wouldn't do something like pressure on the back of the leg. So just make sure that you're healthy if you're trying any of these techniques. Another item that you probably have at your house that makes a really fantastic DIY foam roller is a rolling pin. So I personally find foam rollers to be too much for me. And if you don't have a foam roller at home, you probably don't want to be using a shared one at the gym right now. So you can sit in a chair and you can gently roll out the tops of your thigh with a rolling pin, and that can be a form of self-massage. I know it seems a little silly, but it really feels fantastic. It's a nice option if you don't have access to a massage. The front of the shins, especially for people who run. I don't run unless bears are chasing me, but I do walk. And so rubbing the rolling pin along the front and sides of the shin can feel really nice. A lot of these things, you know, rolling on your foot, or even using the tennis balls under the ball of your foot, that can help, especially if you're wearing high-heeled shoes every so often. Another tool that I like to use for self-massage techniques is this is a Nerf tennis, or it's not tennis ball, a Nerf, what is this called? I'm not a sports, football. So things like the sides of your ribs, the sides of your back, these can hold some tension. And you can just lean on something soft like a Nerf ball, and that can be another form of self-massage. Now the last thing I remember now that I wanted to tell you about was that psoas muscle stretch. So that muscle that we call the stress muscle. If you're just sitting in a chair, so if you're sitting in your chair and you're starting to feel a lot of tension, how you're going to feel psoas muscle tension is in the front crease of the leg, or sometimes even in the low back. Just turn to the side in your chair, and you can take that back leg back. This might be plenty of a stretch for many people, or you can take your arm up over your head and lean. So basically a lunge, but if you can support yourself, then that muscle can actually relax instead of needing to hold you up while you're doing that lunge. All right, so that is all that I had planned for you. Oops, I talked a long time. If anyone has any questions, I would be more than happy to answer them.
Thank you so much, Rita. I don't see any questions have come through Facebook or through the chat, but you did such a wonderful job just going over how we feel pain are the sensation and perception, and that demo was so useful. I found myself doing it along with you, so I was definitely back here doing it. And I really enjoyed also your shift in thinking of pain into one of gratitude. I think that's a great way to shift your perspective on pain, rather than finding it like being worried about it right away or scared or just annoyed about it, that it's something to be grateful for, that your body's telling you what you need. So thank you so much again for this in-depth presentation. It was really useful information. Since it is 7:40, I think we're gonna wrap up here right now. But I just want to reiterate, like I said the last 2 evenings, that we are so lucky as at Mount Mary as a campus community to have so many faculty and staff and just experts as a whole who are willing to volunteer their time and who are so invested in the mission of Mount Mary to develop the whole person in addition to the academics. So thank you again for everyone who did a presentation as part of our webinar series. I think it was so useful to get this information out, particularly as we are all learning how to live in, you know, this stay-at-home world right now. Like I said earlier, this session is recorded. The previous 2 sessions were also recorded. So those will be available after our sessions today. But thank you so much for joining us for our 3 webinar series. We hope that you found some useful information out of this, and have a great rest of your evening, and thank you again for joining.
Thank you. Hope to see you all on campus.